Hello, welcome to the Health and Safety recorded webinar. Thank you for joining me. Let's move on. What are we going to learn? Our learning outcomes. We're going to look at our rights and responsibilities for both employees and employers. Under the occupational health and safety legislation, we're going to focus heavily on the Ontario health and safety legislation. We're going to talk more about WHMIS and explain what it is and why we do it. And we're going to look at the three basic causes of accidents. So let's proceed with more of the outcomes. We're going to look at how accidents at work can be prevented. We're going to also discuss 6 major employee health issues at work and recommend how they can be handled. And due diligence is really important for companies, so please pay attention to this because I will add some extra bonus features that is not in the slides or the textbook that will help you both professionally and personally. We're going to talk about employee wellness programs as well. So I hope, first of all of you are healthy and safe during this COVID-19 crisis that we're going through, and please support one another through social and physical distancing. Okay, so let's start. So strategic importance of occupational health and safety, well, looking at it from a perspective of bottom line returns for a company, that it does cost companies money when people are sick, injured at the workplace. And here is some unfortunate stats that, and this is almost 10 years old. However, please keep in mind the percentage. If there's 919 deaths and 249, 511 injuries, how big is your organization? How can you prevent this from happening? Some organizations or industries rather will have higher stats like mining and construction, but we can all do a part in preventing deaths and workplace injuries. And workplace injuries can be cuts, can be trips, falls, hazards. It can be lacerations, illnesses as well, and we're going to talk more about this in future slides. So occupational health and safety. So for Ontario's the Occupational Health and Safety Act, it's also known as the Green Book. You'll find this in companies. They have to have this readily available for organizations, for their employees to read. The whole premise of health and safety legislation is ensuring that it is a joint responsibility. It's an effort between workers and employers to make sure that the workplace is a safe one for all people concerned, full-time, part-time, consultants, visitors to the workplace, making sure it's safe, and also for the community, ensuring that we're doing things in a safe manner. Its intent is to minimize work-related accidents as well as illnesses. The law itself falls into 3 major categories: the general health and safety rules that are specific to industries. As I mentioned earlier, mining and construction have really tight rules. So it's on top of the normal standards, and rules related to working with specific hazards such as asbestos. So let's proceed. Employer responsibilities. This is called due diligence, and this is really important that organizations prove that they have taken every reasonable precaution to ensure the health and safety of the workers. Ensuring that specific duties, that reporting any accidents that take place through Workers' Compensation Board. Also, excuse me, if there's any chemicals that are leaked, you have to do specific reporting. If there's a death, there's another reporting. Maintain records for compliance reasons. Ensure that safety rules are enforced by all employees, not just managers telling employees, but all employees need to follow the rules as well, and that you have to have a disciplinary measure if they're not, but also training is super important. Ensuring people understand the safety. This is an allergy, so don't worry, I don't have COVID. Posting safety notices and legislative information. There is a requirement for companies to have that Green Book, which is the Occupational Health and Safety Act, readily available. Employees' responsibilities and rights, making sure that you're protecting employees, you're training them, you're giving them protective clothing and equipment. So right now with COVID, you should have gloves, you should be given masks. These are things that you have the right too. And if you feel that it's unsafe, you can actually refuse unsafe work, and you are protected under the Ontario Health and Safety Act. You must be trained and know about workplace safety hazards. If there's chemicals, you should be trained on WHMIS. You should be trained, which we'll talk about more, understand the labels. You have the right to participate in the occupational health and safety process, as well as join a committee. So let's talk about committees. First of all, it's a non-adversarial relationship between management and labor or the employees to work together to ensure that everybody is safe in the workplace. So that means it's a cooperative committee that protects the members and ensures that issues relating to health and safety are brought to the table and addressed and rectified by bringing it to the attention of management and getting their approval. It also involves inspection of workplaces. It is based on the size of the company. If the size of the company is very small, it's less than 10 employees, one health and safety representative may be considered, and it has to be a vote. The company cannot force an employee to do it. It has to be a vote with all the employees. And if it's a larger company, if it's over that 10, you can have anywhere from 2 to 12 members of your health and safety committee. At least half or more have to represent the workers' side. Again, the workers have to be elected by the workers, cannot be delegated down. People can volunteer, but again, it has to be a vote. So please keep that in mind. All right. The supervisor's role to ensure workers comply with the occupational health and safety regulations, not only with the Ontario Health and Safety Act. There should be policies and procedures. You need to train the employees, instruct them how to do the work safely, let them know if there's any chemicals, hazards in the workplace, provide those personal protective equipment. And if people are not doing the work safely, the supervisor has a right, responsibility to ensure that that person is aware of what they're doing wrong, train them, but also enforce disciplinary measures if at all possible, because it could be hazardous to other employees. So understanding the different roles, that there is also enforcement, that the government can come in at any point in time and inspect your workplace, enforce, and even close down your shop if it is not safe. They can impose fines, even jail term, not only to the company executives, but also to management. So keep that aware. Corporate killing, a criminal offense, failure to ensure an appropriate level of safety in the workplace. So that's where, going back to the previous slides about due diligence, ensuring that the workplace is safe for all workers, that is important for you as an employer. Okay, and understand that the government has teeth. So the Minister of Labor has teeth here. They can impose fines to the company and to management and to executives. There could also be jail time. So in terms of Ontario Health and Safety Act, we are already aware of the different kinds of acts and legislation, because I brought that to your attention, I think week 2, week 3. There's the human rights for Ontario, it's the Ontario Human Rights Act, and there is a commission that helps with the tribunals and any issues. Labor relations, that is the Ontario Labor Relations Act for Ontario, and you have also tribunal, the Labor Relations Tribunal, that helps reinforce contracts if there's any issues in administration, but also helps with mediation and arbitration. There is the Employment Standards Act for Ontario, super important to know because it relates to wages, it relates to breaks and leaves. It may lead to confusion though, is in terms of how does a person file a complaint? Is it a health and safety issue? Is it a human rights issue? Looking at workplace fights and violence in the workplace, you need to have a zero tolerance policy for any type of violence in the workplace and any type of harassment or sexual harassment in the workplace. Also understanding that there may be some religious rights where employees and visitors may wear a ceremonial knife, also known as a dagger, and in understanding what is more important, the human rights protection of religious beliefs or the safety of the employee. So I would seek legal counsel on that advice. I would also speak with the representatives of Human Rights Commission, as well as Ministry of Labor for standing on that. So what causes accidents? Well, first of all, there's chance occurrences that's beyond management or other people's control. There could be unsafe conditions. So is the equipment maintained? Are people trained on it? Are they safe? Are there procedures, standard operating procedures on how to handle that? Are there material safety data sheets to inform people if there is ventilation required? How do you store chemicals? What is lighting like? Even lighting, too much lighting, not enough lighting can also be unsafe. Are you working, let's say, on ladders? Are you working in a mine shaft? Are you working in a confined space like elevators? The job itself can be hazardous: mining, construction, elevators, working with chemicals, hazardous chemicals. Also the psychological climate, mental health and stress is also something that needs to be addressed in your workplace. Your schedule, looking at too much overtime. Too much overtime, people will be burnt out, quality will go down, but also people could work unsafely. So keeping in mind those unsafe conditions, and you as an employer have the right and responsibility to make sure you're making it a safe place. Unsafe acts, thinking of repetitive strain injury like carrying, lifting. Are you sitting down all day, which is not good for your health? Are you standing all day, which can also be affecting employees' way of life? Operating machinery, unsafe speeds, looking at forklifts, even cars, horseplay, making sure that people are working safely and they're not throwing watermelons at one another at a distribution center, quarreling, fighting, zero violence in the workplace. WHMIS, so this is really important for you to know. If you are working with toxic substances or hazardous materials such as asbestos, you have the right to be trained as an employee. You have the right to information such as material safety data sheets, which talks about the chemical, how to handle it, how to store it, what happens if you're in contact with it, should you wear personal protective equipment like masks or gloves or even face shields. You have to label this hazardous material containers, particularly if you're transferring material from one container to another. You need to make sure that the right labels are on it, making sure employees understand the labels and train them on it and do it yearly. Here are some symbols that relate to WHMIS, and these symbols should be on a label to inform employees before they touch the chemical, even if it's in a glass container, plastic container, whatever container it is. It has to inform the employee in advance visually through these symbols of what it may contain so it can protect them. So looking at your gas cylinder, looking at your radiation, which is your biohazards as well. You need to look at flames, skull and crossbones, that you will, if it's toxic, you're going to need to wear certain personal protective equipment. You may not even have to touch it. Maybe it's a robot that touches it. So understanding these symbols is part of the WHMIS training that you by law are entitled to if there are hazardous materials at the workplace. I'm not going to talk about the Think, Pair, Share, but I welcome you to please make it a collaborative environment, because we may have physical distancing right now because of COVID, but let's talk about COVID yourselves in terms of how we can mitigate the risks, how we can create a safe condition. Look at the colleges, what have they done for their work schedule, that everything's done online, preparing and planning in advance, okay? So I welcome you to do social chatting with one another, Skyping, Zooming, but don't meet one another face-to-face to maybe tackle these Think, Pair, Shares. Personal characteristics. So looking at accidents and various types of human traits related to accidents. So things like age, literacy, do they even read the labels? Do they know what the labels are? Can they understand the labels that we mentioned earlier? Vision, perceptual versus motor skills. Excuse me. I'm doing a lot of training online, so I have a dry throat, so my apologies. How personal factors may influence employee accident behavior. So looking at, are people motivated to learn, make it a safe workplace? Do they even understand their responsibilities and rights and how it helps benefit others? Predisposed behavior tendencies. Some people may say, oh, it's not risky. I've been using this machine for 30 years. Well, what happens if somebody new comes on board and isn't familiar with your machine? So understanding that there may be some attitudes around risks that they think, oh, everything's fine. And that's where your job in HR is to not only educate, but also help people be motivated and understand that it is part of their job. And also, it makes you feel good to help one another as a team, that everybody leaves their workplace with all your digits. You need to have all your 10 fingers, all your 10 toes. When a person comes into a workplace, they need to be able to leave that workplace in the same manner, healthy, safe. Types of behaviors in special circumstances. So people could be, they could forget, they're not paying attention, they're not doing their job properly, they're failing to perform based on operating procedures, they're assuming risk. Oh, I've done this 35 years, I don't need to wear my guard, or I don't need to wear my mask. So those things, you need to have a disciplinary policy to make sure that it makes people do it. But I like to inform people on a positive note versus a punishment reward, by rewarding people by saying, hey, good job, thanks for making it a safe workplace, versus punishing people. But letting people know that there is a disciplinary measure, letting people know that there is health and safety policies. So incidents of specific accident behavior, looking at the probability that the rate of individuals' accident behaviors. So looking at rates of how many accidents you've had this month versus last month, seeing that hopefully you have a positive trend, that less people are getting hurt, because you want to reduce those unsafe conditions. You want to reduce those accidents on the workplace. You want to make sure people leave the workplace healthy and that they don't get illnesses when they leave. So how to prevent accidents? Well, the first thing you should do is remove the physical hazard. You should do job re-engineering, job design, making sure that that's your first mode of operation. Personal protective equipment like gloves and masks, that should be last, okay? You need to job redesign. And this is what they did for the colleges. They made everybody work from home to make sure it's a safe workplace. So they redesigned the job, right? So this is a hybrid. So that's the best way that you could do versus giving everybody gloves and masks if you were to come into class. Reduce unsafe acts, so making sure that, first of all, you got the buy-in and the commitment from the executive and the management team. Please try to sell them softly, sell them the soft sell of telling them how it benefits productivity, increased performance, less employee turnover, people will show up on time, they'll be happier, versus telling the executives that they could go to jail. Never do the hard sale. Leave that last and do it more politically correct than that. Make sure you train and educate everyone, not just employees, management, and executives as well. Make sure that testing's done, and positive reinforcement, like I said earlier, make the punitive or punishment as your last recourse. Controlling workers' comp costs, because not only is a death and accident horrible, it does cost companies money because people will use workers' compensation, and every time a company gets experience ratings on that and a lot of people are using it, they will be billed more money on their premiums. Also, it's negative public relations. People may not want to join your company because it's unsafe. Also, the fines that I talked about earlier. So before the accident, make sure you have prevention in place. Make sure that you look at every aspect of the job through job analysis and how can we make it safer through job redesign. After the accident, make sure that, first of all, the person is safe. Everyone is safe. Person is safe. Get first aid. Make sure people are first aid trained. Even though you may have one or two people, I invite all employees, if the company can afford it, get them all CPR and first aid trained. Make sure that person gets medical attention immediately, even if it means calling 911, you have to do it. Show interest and care, genuine care that the person got hurt. Do not assume, do not presume. that the person did it maliciously or that they were lazy. You know what? Injuries happen at the workplace, so please be empathetic. Document, file your accident reports with the Workers' Compensation Board. Make sure you have your own records. Take down if anybody saw anything, and encourage a safe and early return to work, not a speedy. I would call it a safe and early return to work. And you may have to partner with Workers' Compensation Board. You cannot speak with the doctor. You need to speak with your lawyers, speak with the employee on a regular basis, and please be genuine about it. Occupational health and safety challenges in Canada. Well, one of the biggest one is mental health. Bell Canada does a great promotion I think it's the end of January, that talks about mental health and helping people support one another and companies support employees on that. Substance abuse, both alcohol and drug addiction, and also looking at marijuana now. Be very, very careful because some people are prescribed marijuana, medical marijuana, so you cannot ask for a prognosis. What you can do is ask how you can accommodate if people come to you. Job-related stress, as I mentioned earlier in another class, workers' compensation claims are being more and more tapped into that because unfortunately our workplace is not promoting health and safety. Repetitive strain injuries, remember my examples in class about the auto worker closing the door 100 times an hour? Well, could you envision if you're doing that now 8 hours, 5 days a week, and now years? That's going to build up some issues. Hazardous materials and toxins in the workplace smoking, making sure that you have signs that no smoking is allowed in the workplace. COVID-19, that's the viral pandemic that we're going through, and violence at the workplace. So substance abuse, as I mentioned in class earlier, please be very, very careful because in some cases, medical marijuana is prescribed, but you can state that people can't smoke, chew, or absorb the product in the workplace. However, a person could be able to do it during their breaks, so you have to make sure that the place is still safe, but you're not treading on waters of disability. Testing is only legal if it's a bona fide job requirement. So thinking of things like pilots, essential jobs that require it. Otherwise, you're going to have to do a good faith belief that people are doing their job and that they're able to do their job. Also understanding that alcoholism and drug addiction and other addictions are considered a disability under the human rights law. So Ontario Human Rights Commission and the Act will state clearly what is considered a disability and substance abuse. And your role is to create some sort of rehabilitation for that person, give them time off, maybe even pay for their rehab. Substance abuse testing, random testing is illegal. You have to forewarn. There are some safety sensitive jobs. Think of pilots. Think of why you're doing the testing. It has to be for cause. You can't just pick out people. It has to be based on the job, okay? Positive tests must result in accommodation. And if the person discloses that they do have a substance abuse, you have to accommodate up until the point of undue hardship. Please speak with legal counsel, both internally and externally, to get additional help. Please partner with unions if you have one on board. You cannot disclose the person's addiction, substance, that they do have a disability, but you can ask for general help on how to work with employees that do have substance abuse issues and you want to partner for accommodation. So please work with your union as early as possible, but do not disclose names. Immediate termination of substance abuse is not generally justifiable. That's why it's important to have a disciplinary policy in place that does address this, but also takes into account human rights disability. Dealing with substance abuse, well, first of all, not everyone has the trained eye, and it can be also very difficult to detect if there are signs of impairment. If somebody has dilated eyes, maybe it's because they just went for an eye exam. Um, do not assume that you are an expert here. And it is very difficult for employees and management to detect this. You can record the observed behavior, but A, you are not a doctor, and B, you don't have the test. So you can just discuss what happens, but maybe that person got off on the wrong side of the bed. Maybe they got some bad news. So keep that in mind. What you think may be a substance abuse or an impairment, maybe something underlying from that. Please, if do encourage employee assistance program to employees that you detect that may be suffering in any shape, form, or fashion. I would educate employees on a regular basis anyway. It shouldn't be, a reactive, it should be proactive. Techniques for dealing with substance abuse. Well, we talked about the disciplinary measures in class. Discharge, you may even give a person time off with pay, rehabilitation, in-house counseling if you have one on board and you're lucky enough to have a nurse and somebody on board, and you may have to refer them not only to an EAP but a rehab center. Job-related stress, well, there could be personal factors, but also environmental factors. Is the job really stressful? Tight timelines, a lot of workload, very physically, mentally demanding, but also looking at the person themselves. Are they type A personalities where they put on more than the next person does? How do they handle ambiguity? Maybe the job is very ambiguous and their tolerance level for risk isn't great. Is the person sleeping right? Are they eating right? Are there underlying health problems that aren't being disclosed? Okay. How can we reduce job stress? Well, first of all, realistic job preview is important. Supporting your employees, you as management need to support your employees without prying about health issues, but letting them know that you're there to support them and help them. Making sure people do take vacations, not these working vacations where they're in Hawaii and working, on their cell phone and missing the sunset. Let people take their vacation. Also offering the EAP counseling, and training managers on how to support people without criticizing and going right to the disciplinary measures. Also have managers partner with HR and say, hey, listen, I have a problem here. I'm not going to disclose the employee at this time, but these are the things, and how can I treat this person fairly? Here's another thing, pair share. I want you to think about this. And I highly recommend how can we reduce stress in the workplace? Think of it as a manager, think of yourself as an employee, and think of some strategies. Burnout happens a lot, particularly because we're so tuned into technology. We're never turned off. And I think, turning off your technology also helps. So making sure that we avoid burnout over time, looking at the job itself, looking at ways of giving people breaks, looking at reassessing goals instead of having people do really tight timelines, maybe have company goals and personal goals not conflict with one another. Don't take French and learn it in 3 months and you have a major product or service or software or whatever you're going to roll at the same time. Make sure it's tiered, make sure you give people enough time. Looking at the person is not a robot, they're human beings, so making sure that they're not burning out. Workers' compensation, as I said earlier, that workers' compensation stress leave, also mental health leaves, post-traumatic stress. Think of people who right now for COVID, nurses, paramedics, doctors, they're under a lot of stress. And they're going to see more and more fatalities and illnesses and injuries. This is going to be totally and taxing to them. They may have to go on workers' comp. They may have to go on this stress leave. And that's where we have to be very empathetic. Even if they're not a nurse, doctor, what happens if you're a TTC or a bus or a subway and you see somebody die? It's traumatic for people, especially road rage, things that's happening now with COVID, that could also lead to post-traumatic stress disorder. So keeping in mind that we need to have a positive attitude to support and not blame. Repetitive strain injuries, you've heard of carpal tunnel syndrome maybe. That's where your arm and your wrist from doing too much mouse and keyboard action. It could be those Oh, my dog's going to bark soon. You're going to hear of, automotive, or, things that are physical, demanding, and repetitive in nature. Closing that door 100 times an hour will create that type of repetitive strain, but also look at eye strain, back, neck. That's from sitting in front of a computer all day. So how can we make it a better work environment? Well, you may have to get an ergonomic specialist to look at your work environment, document, and see if you can make changes at the workplace. Advise train workers, try to reduce and re-engineer the work, so that way maybe standing desks versus sitting desks, maybe the desks that move up and down. Try to look at ways of making the equipment better for your employees. Workplace toxins and smoking. So looking at toxic chemicals, substances, and looking at the latency of these things. So asbestos. People who smoked and worked with asbestos, either mining or even working on brakes, increase the person's fatality. Cancer, due to cancer. Smoking is banned in the workplace, making sure that the postings are done. But why don't we offer a free smoking cessation program? Offer yoga, offer some better alternatives for employees and support them. Well, look at a viral pandemic that we're going through now with COVID. Most companies don't have a plan. And as I said back in January, what are we going to experience? Two things: financial meltdown and a pandemic. I didn't know the date, but you're going to experience that again. So learn from this, from what companies are doing, what's right, letting people work from home. And if you do have to make people work, make sure you arm them with personal protective equipment like gloves, Purell, making sure that you're allowing people to work from home if possible, masks if needed, maybe fully gowned from head to toe. Pandemics will affect absenteeism, so be proactive and allow people to work from home remotely. Give the people pay, like Starbucks, which gave them 2 weeks pay for not working, and if you chose not to work, you could get paid up to a month. Making sure occupational health and safety is on site to help support employees. Violence in the workplace. You should have a zero tolerance to workplace violence, and you need to communicate it, you need to train people, and you need to get them to sign off that they have the training. Making sure that bullying and harassment is prohibited and that it is liable for discipline up until the point of undue hardship. Making sure that you explain that you want all employees to come into their workplace feeling safe and being safe. And ensuring that employers do not condone any violent actions, that they respond to it, that they document, and they use their disciplinary measures. Unfortunately, Canada is the fourth worst country in the world for workplace violence, and the US follows us by 7th. Reports of abuse by clinical area. So think of healthcare system. Think of long-term care homes. People get angry when they're in pain. I'm not condoning their action, but they can throw things at nurses. And I'm giving you an example because my mom's a retired nurse, both at the hospital, but also at long-term care homes. And patients can and have hurt people, A, because they're in pain, or B, they are not aware that they are creating that pain. So understanding that certain professions, certain industries have violence, have abuse. People may yell at nurses. And again, I'm not condoning it, but my mom has been yelled at. Things have been thrown at her. She has seen one patient break every bone in that person's hand while trying to pick them up. So keeping in mind that abuse can take place in a workplace, but you need to have prevention and control measures. You need to identify industries, jobs that are high at risk of that. As I mentioned, in the healthcare industry, it's nursing, because they're the front line for patients. Making sure you have an anti-violence at the workplace policy. Create and promote that healthy work environment, making sure it's a supportive one. Making sure you have security measures, CCTV cameras, maybe some security guards, maybe both. Looking at the college, I invite you, when we do go back to the college, please look at the CCTV cameras, look at the security guards, look at what we have in place. Making sure you're providing training on not only workplace health and safety, but also zero violence. And what does violence look like? What does harassment look like? No bullying in the workplace. Improve employee screening. That means right at the interview process. Do they care about health and safety? Ask them if they had health and safety training. What are their beliefs and norms about it? Employee wellness, you can offer activities on top of that, maybe a gym at the workplace. I've also had free smoking cessation programs. Do you allow yoga and Tai Chi? Having ergonomics people come in to look at your workplace. How is the seating arrangements? How is the work being performed? Can it be done better in terms of job redesign? Reducing stress, being supportive of employees, having management trained on how to support their employees. Nutrition weight management programs and an EAP program.